my name is Natasha. I am a student nurse at the University of Manitoba, and today I will be demonstrating how to reconstitute and administer an IV medication via a piggyback with a mini bag. So the first thing I've done before this video started was I compared my physician order to my MAR to make sure it was transcribed properly, and I also drew my medication out of the Pyxis. So it's time to do our first med check. So my medication today is going to be cefazolin, which on my MAR here it is the right med. I need 500 milligrams for my dose. This is 1 full gram, so it's enough to get our desired dose. The rest is going to be IV, and this is good for IV. We're giving it every 8 hours, and the first dose is due today at 8:30, and right now it is just before 8:30, so we have the right time. Our patient today is going to be Professor Albus Dumbledore. He's a 105-year-old male, and he's in today with pneumonia. It is a bacterial infection pneumonia, and this is an antibiotic for that, so we have the right reason for giving the drug. So before we start, we're going to check our drug monograph. I'm going to make sure that this dose is safe to use, so it is, the usual dose is 500 milligrams. And the maximum single dose is a full 2 grams, so we have the right, we have an acceptable dose here. I'm also going to make sure that as a student nurse I can give this drug, which I can, and so we are ready to reconstitute. So it says for this 1 gram vial, we need to add 10 milliliters of sterile water. So I have here my sterile water. I'm making sure my vials are not expired or that they're both in okay condition to use. And then I'm going to swab both of my vials. We would do this for a full 30 seconds. And we would then allow it to dry fully in real practice. So my sterile water, again 30 seconds. While they are fully drying, I'm going to get my 10 ml syringe and a blunt fill needle. And I'm going to attach that here. Then I'm going to take some air to insert into my sterile water vial. I'm going to uncap that. I'm going to introduce air. Then we're going to draw back those 10 mLs. Okay. I am going to recap my needle here. Then I can make sure that I have all my air bubbles are gone. Alright, push up to get my proper 10 mLs. Okay, now we can inject this into our medication vial. You can see this is a pretty high pressure vial, so we want to draw back some of that air there to release some of the pressure. And then we can recap our needle. All right. So now we're going to reconstitute by gently rolling this between our hands for 3 to 5 minutes. We don't want to shake it because we don't want to introduce any air into the vial. We just want to gently roll it until it's all reconstituted. Okay, once that's done there, now we can calculate the dose that we want to draw up while we sanitize the top of it. So the dose that we want today, so we added 10 mLs of sterile water to 5 milligrams. Or 5 to 1 gram of medication, and that'll give us a total concentration as per our monograph of 95 milligrams per milliliter. To get our desired dose of 500 milligrams, we want to drop 5.2 milliliters. 5.26 milliliters. I'm going to make the decision to drop 5.2 because our markings on our syringe only allow us to drop either 5.2 or 5.4. 5.2 is closer to 5.26, and it's a little bit under, so it's a bit of a safer dose for us to give today. So we're going to drop 5.2 mLs. So I'm going to inject just a little bit of that air back into the vial here. Okay, and now we can draw up that 5.2. Alright. We can recap our needle. Okay. Pop those last bubbles. And get up to our proper dose of 5.2. All right, now we can do our second med check before we add to our diluent. So we are going to verify here that the drug that we drew from is still going to be cefazolin, the right drug. The dose is going to be 500 milligrams, which is going to be 5.2 mLs. We're giving it IV still, and the time is still 8:30, so it's the right time, and our patient is still going to be Albus Dumbledore. All right, so now for a diluent, on our monograph, I see I can give dextrose and water. I can give normal saline. I know the primary that's running is normal saline, and so I'm going to give a normal saline as my diluent so everything is compatible here. I've chosen a 50 ml mini bag, and my next critical thinking point is I'm going to be running it over the full amount of time that I possibly can, which is going to be 60 minutes. This is because I want to be able to monitor how Mr. Dumbledore is reacting to the medication. It's the first time he's ever received this type of antibiotic, so I want to monitor him for any allergic reaction, adverse effects, and just make sure he's tolerating it well. So for our bag here, our total concentration, once we add this, our medication in, is going to be 55.2 mLs over 1 hour. So that's going to be the rate. So I've written all this information here with the patient's name, all the calculations on a label here, and I've put down the date and time, and I've signed it. All right, so to dilute it here, I'm going to again swab this port here for a full 30 seconds, allow it to dry. I'm going to inject my medication into here. All right, now this can go into the sharps container. I'm going to add my label to my bag here. All right, and now we're ready to go to the bedside. So I'm going to bring with me my label bag, a new extension set. I have a label for my extension set tubing at the bedside. I'm going to perform hand hygiene, and I'm going to bring my marks. Now we can go to the bedside. So as we walk in, we're going to introduce ourselves and say, hello, Professor Dumbledore, my name is Natasha. I'm a student nurse. I'm going to be giving you your medication today. We're looking around for anything that looks unsafe. We see that his call bell, we'll need to pass it to him before we leave. We're going to look for any tubing that's kinked. We're going to make sure the IV line here is running properly. We're going to say, hi, I'm just going to have a look here at your arm and your IV site. So on the IV site, we're looking for any redness, any swelling, pain, or tenderness, or signs of occlusion. And then here at his armband, we're going to say, okay, I'm just going to compare your armband to my MAR. Could you please confirm your name with me and your date of birth? Okay, thank you very much. So we've confirmed we have the right patient. And so I'll let you know a bit about the medication we're giving today. It's called cefazolin. It's an antibiotic. It's to treat the infection that you have in your lungs and help to get rid of your pneumonia. Some things you might want to look out for while you're on this medication is if you have a rash, you might have an upset stomach, like nausea, diarrhea, you might have a headache. Another thing I'd like you to look out for is if you notice any unusual bruising on your arms too, to look out for that, please. I'll leave you your call bell, and you can call me anytime, and I'll also be back regularly throughout the course of the antibiotics to evaluate how you're doing. Another critical thinking point giving this medication is that we want to make sure that we've been assessing his lungs before giving it and throughout the treatment to see how it is working to treat his pneumonia. And I also, because this drug can have an effect on your kidneys, I want to make sure that he is urinating normally, so we're going to keep checking in on that. All right, so now we're ready to do our third med check. So we have our MAR, and we're going to do it off of our label here, just confirming that we do still have the med cefazolin. We have 500 milligrams is in our dose in this mini bag here. We are going to be giving it IV, intermittent, and we're going to be giving it at the right time, which is 8:30, so we're at the right time. And we are giving it to Professor Albus Dumbledore, who we confirmed is the right patient, and we also will offer him the right to refuse the medication during our patient education. All right, so now we can start setting up our tubing set. So the first thing I want to do is I'm going to lower the primary,
which is output will enable me to draw enough that I need for my patient, and it's going to be given via IV.
And then I can spike my mini bag here.
Yeah, IV, and the time to give it is now. So I'm going to go to my drug monograph to see if I can give this as a student nurse. And here it says it can be administered by a student nurse. I'm also checking for the maximum dose.
So I can just place this in its on
my patient
here. All right, now we're going to back prime.
It's 12 grams.
So I'm going to clamp this to start.
What my doctor has ordered is 1,005, and it's within the range. Also, I'm going to check what I need to add to constitute.
All right, so now we're going to swab this port here. We're going to do it for full 30 seconds again, and then we're going to let it completely dry before we attach this.
What I need to further dilute it with, it says at least 100 ml of 55 normal saline.
We're going to attach this port. Then we are going to make sure the clamp's open. We are going to lower this, and just allow that drip chamber to fill until it's about half full to 2/3 full, so that's good there. We're going to hang it up,
I'm not taking the D5W because
and I'm going to just reclamp it for now. Now it's time to set our rate. So we are going to go to our secondary. For our rate, again, like we said, we're going to want 55.
I'll go ahead and
We can fit in 55.2 mLs per hour is going to be our rate, and the total amount to infuse is going to be 55.2 mLs there. So we can confirm our secondary. We can open up our clamp here, and we can click start. Now we are going to watch here that it's running, it's not having any alarms. We're going to make sure that we watch that it's going to drip at least 3 times there. And then now that we see that it's running, we can add our label onto here. And then now we can go and we can document initial RMR, and then we've given our medication.